In this next lesson, we're going to talk about Bursae and synovial joints. Here's your objectives. So in the previous lesson, we talked about how you can have a diarthrosis, which is a joint that has substantial freedom of movement. And these are typically synovial joints. Synovial joints are articulating bones that are separated by a fluid-filled joint cavity. And here's some examples you see here. Here's your elbow, your shoulder, your wrist, your fingers, your hip, your knee. These are all synovial joints. There is a more extensive discussion about synovial joints in the lab portion. But just as a brief overview, you have what's called articular cartilage. That's here at the ends of the bones. You have a joint cavity, also called an articular cavity. You have an articular capsule. Kind of see it over here. Here's this kind of right here. This articular capsule, which has a fibrous layer and a synovial membrane here. This fibrous layer is continuous with the periosteum. And then you'll have reinforcing ligaments as well. Now the inside of those joints aren't the only places that have structures containing synovial fluid. You have these other structures here called bursa. Now a bursa, singular is with an A, plural is with an AE, but a bursa is just a flattened fibrous sac that contains synovial fluid. Typically located where ligaments, muscles, skin, tendons, or bones will run together. Here's an example here. This is the humerus, the head of the arm bone. And you kind of have this little bursa here between this bone and this ligament. Helps decrease friction, allows better mobility of the joint. Now a tendon sheath is a bursa that wraps around a tendon. So here's an example here of the long head of the biceps, brachii muscle. It's a tendon that connects muscle to bone. Surrounding that is this tendon sheath. It kind of comes all the way around here. Again, that helps to cushion and protect this tendon as it's coming around these other structures here. These tendon sheaths are found throughout the body. Here's just another example of one that you might see in the hand. And there are these things that are covered in this light blue color here. These are the tendons, and these are the tendon sheaths. They involve your fingers, and then your hand bones, and then here in your wrist as well. And when we're talking about synovial joints, oftentimes we're worried about stability of those joints, and that's to help prevent dislocation or misalignment. Perhaps you've heard of maybe somebody who dislocated their shoulder, and so you want to try to avoid that as much as possible. Dislocation of fingers is another thing that can happen as well. So when we're looking at stability of a synovial joint, it depends on three things: the shapes of the articular surfaces, the number and positions of ligaments, and the muscle tone. Here's an example of synovial joint stability. There's a difference between this joint here and this joint over here. This one over here has much greater stability. For example, the shape of the surfaces. So we have this head of the femur here, this shape here, and then this the acetabulum. It's a ball and socket type joint. So there's a lot more stability here just because of the shapes of these surfaces compared to these over here, where you have facets, which are very flat, not too much in terms of interaction between the two joints. I'm sorry, between the two bones. So it's less stable compared to this hip joint. Another thing that affects that is the number and position of the ligaments. So here at the elbow, you have lots of these ligaments kind of covering around over here, right? But in the knee, there's many more ligaments actually. This is just a cross section, but there's many more ligaments in the knee compared to, say, the elbow or even the finger, right? So ideally, it's less likely for your knee to be dislocated. It's still possible with enough force and trauma, but compared to, say, maybe your elbow or your finger, or even your shoulder joint. And finally is muscle and tendons, right? So this is probably the most important factor in stability of your joint. So here's an example of the knee joint here. You have the muscles up here and these structures down here. They're called retinaculum, but it's kind of like a tendon attaching the muscle to the bone. So when you have good solid strength in these muscle tissues surrounding this joint, it helps to reduce the risk of injury, which is why in athletics, doing the exercises and weight training and all that stuff help with the stability of your joints. All right, so that's it for this one. We'll see you for the next one.